Hey guys, Rosie
Hey.
here,
Oh, and Jack.
and that's Jack, my partner. And this is actually a very pertinent video this week because Jack got his drains out yesterday. He had surgery last Wednesday.
Yep.
Not like a week ago last Wednesday.
Yeah,
You get it.
not yesterday. 2 yesterdays.
2 yesterdays ago. So we're very much in the middle of this right now.
Yep.
He did just have a double incision mastectomy, so he had both of his breasts removed through an incision, not through a keyhole. You want to talk about that?
When I went to get my consult, the doctor was like, you can get either a keyhole or a double mastectomy, and a keyhole is when they cut around your nipple, remove the tissue from that hole around your nipple, so it doesn't leave the double scars underneath that you think of as a trans man's chest, but it can leave scars, and I decided to get the double mastectomy because I just think it looks better, but the doctor was like, I have no medical opinion, so it was kind of hard for me for the first little while.
Yeah. It was a tough decision, but in the end, Jack felt like he'd get a better shape with the double mastectomy.
And I'm very glad that that's what I did.
It looks amazing. Here.
It's kind of hard to see when I'm sitting down, but...
But it does. It looks really amazing. The doctor was astounded by how well it went, so
the
we're
nurse
really
said that I
happy.
was better than textbook.
Yeah. So this is really good. My experience surrounding Jack's surgery was that I really supported him having it. I never minded that he had breasts. I consider myself queer, very open-minded, and I, have dated women, men, and obviously trans men, so,
And the freaks in between.
and all the freaks in between. So I didn't care. I didn't care that he had breasts, but it was making him increasingly uncomfortable, especially after he went on T and his breast tissue started changing, and he was feeling pretty disgusted with him a lot, and it made him uncomfortable sometimes during sex. And so I was excited for it. It was a new experience for me to nurse someone, which I have been, but he's a pretty excellent patient. So it really wasn't a problem. I'm really happy for him, and I think his chest just looks incredible. So,
Zombie nipples.
he does kind of have he has zombie nipples.
It's funny because we got those brain gummies. It was like they were feeding my nipples.
We did. It was... Sorry, guys. Okay, so,
What do we do?
Jack is not considering bottom surgery. He's done a lot of research, and I'm just going to cover this one pretty fast, okay? He's done a lot of research, and what there is out there right now has a very low percentage of effectiveness, a high percentage of medical problems such as fistulas, and it's very expensive. So
And just never feeling your genitals again.
yeah, and probably it would lead to a complete loss of feeling.
Probably, but
Well,
probably implies that more than 50% of chance.
well, isn't
Anyway.
it? Whatever.
Well, no, but
There's
sorry.
a very good chance, So it's not really down to a science yet, if that makes sense. And it's a lot of money, and he'd, I think, like to keep his current genitals in case something really good comes along one day. And for me, there's a question here, how do I feel about bottom surgery? Honestly, I want Jack to have genitals that do not pose medical problems, give him pleasure during sex, and he doesn't feel uncomfortable with. Well, obviously his genitals don't pose medical problems any more than they ever have. If anything, pleasure during sex has increased. And since taking testosterone, lots changed down there, and he's actually very comfortable with it. No one could say that he has normatively female genitalia anymore, so
I'm aftermarket.
pretty much. I mean, the fact is that he can no longer get pregnant, so, and he has what doctors would call a micro penis, and so...
No, a macro penis.
And so we were talking about it last night, and I was like, actually, if you were born this way, you'd probably be considered intersex.
Which is
is pretty cool. So, anyways, I I am actually kind of glad that he's chosen not to get bottom surgery. I'd support him if he did, but for me, I really like how he is now. He feels very comfortable with it. Things are working out great, and I just feel like, why break something that's, or why fix something that's not broken? So, um, let's see. I think that surgery is actually very important. It's a tough question because there are people who are genderqueer who don't get surgery or only get, one type of surgery and not another or whatever. And that's one thing. But for someone who really desires to fully transition to their, chosen gender, chosen actual, however you want to consider it, surgery is important. It is very uncomfortable to bind, and it's not good for you to bind for long periods of time. And, you know, in order to live stealth and just be comfortable in your skin in everyday life, surgery can allow you to forget once in a while and just live how you are and just allow yourself to be a human being around other human beings and not always have to be aware of how you're presenting and whether or not you're passing and how other people are thinking of you, etc. And how that is affecting your own self-image. That's like a constant drain on one's well-being. And especially, I know having top surgery, Jack has, for a week, he had this annoying binding and drains on, but for a week, he has not had to think about whether or not people are looking at his breasts or notice them. And he is totally different. Like, the level of just ease that he walks out the door with is amazing.
I have, not even been thinking about, I just went out the door with not packing yesterday, and I didn't care.
He didn't even think about it. It's completely amazing, the change. And I think that, surgery is an amazing tool for that. Obviously, everyone chooses, to go a different path.
Mm-hmm.
And some people might actually be comfortable not having surgery. But I think that, and that's, of course that's okay, but I just think for one's personal well-being, that can often be a really amazing tool in the arsenal of the trans guy. And I'd say for options for people who do not desire surgery or may not be able to afford it, well, I think we kind of just covered do not desire, but we were making this video the first time and actually realized that Jack couldn't afford his surgery, so he asked for a loan. He had about half the money, and he asked for a loan for the other half from a close friend who's pretty well off.
Mm-hmm.
And I just realized when he was saying that, if you can't afford the surgery, don't tell yourself, I can't ask for a loan for this.
Mm-hmm.
Because it's not, it's not like a life-threatening surgery. It's not like I'm about to
I wonder if
be
you had good
on the
credit
streets.
if you could actually get a loan.
Get a loan for it. I don't know.
Probably a credit union more likely. But.
Yeah, but prioritize it. Don't think of it as something that's like, well, I don't really need it or whatever. Because if you want that surgery, then you need it. You do need it.
Mm-hmm.
And you can prioritize it, and that's totally okay. It doesn't matter if you're not going to die without having your breast cut off, or if you're not going to be homeless without this money. It's that your peace of mind is going to be there, and the sooner that you have the surgery and you feel so good about yourself, you'll get on top of the situation. You'll pay off the loan, and, it'll be just such a huge, amazing thing in your life. So I think that's...
Oh, surgeons that are available in the area. Okay.
Right.
Lastly, I went to Dr. Melissa Johnson at Bay State Hospital in Springfield, and I would recommend her to absolutely everybody who is in the Northeast. She is amazing. She gave me a fantastic chest, better than I could have ever asked for. Her staff is amazing. They're very professional and very nice. Everybody puts you at ease, and she is wonderful.
And she does specialize in trans surgeries,
Well, top surgeries, I think.
top surgeries. So she focuses on shape and all of that, and
Okay.
she's very comfortable. So, all right. Well, I'll see you all next week, and good luck for anyone who's gonna have surgery.